Welcome to Rapid Harmony. I'm Kyle Emanuel Brown. This is a space for high-achieving souls who want more than outcomes. You want resonance, you want truth, you want a life that moves with purpose instead of pressure. Here, we explore success with the soul and direction with depth. We slow things down just enough to hear your own wisdom again. We breathe, we question, we remember the part of you that never needed permission to leave. Every conversation is an invitation to trust yourself more than the noise around you, and live from that clarity that rises when you stop forcing and start listening. Take a breath, settle in, let's begin. What if surgery is often plan B, but we've been calling it plan A?
That's been the huge problem. Over 90% of these injuries actually don't require surgery.
90%.
Over 90%. And that's not my number. That's statistics from American Medical Sports Society saying that over 90% of musculoskeletal injuries don't require orthopedic surgery.
Oof. And are we just stuck in an old paradigm, or is this a money game?
I think it's more of an old paradigm. The challenge is, in no other specialty in medicine do you see the surgeon first. So when I go lecture and I talk about this, if you have a headache, do you go see a neurosurgeon first? The answer is no. It'd be ridiculous. If you have a heart murmur, do you see a cardiothoracic surgeon first? No, that'd be outrageous. So then why, when you hurt your knee, do you see an orthopedic surgeon first? That's what I want people to sit with and be like, I don't know why I do that. That's the paradigm.
I'm a pretty big no regrets kind of guy, but I definitely have regrets of the surgeon I chose and the fact I went into surgery when I got in 2 car accidents 3 weeks apart to the day, and definitely feel like wasn't the best of choices. So hadn't known you then.
Yeah. We get that a lot. Where were you when I had this surgery, or where were you when I had this injection of steroid or something like that?
Well,
so,
I'm happy to know you now and excited to be going down the process we are. And if you're listening at home, I want to give you a little background on my good friend and guest here today. Dr. Aneesh Garg is the founder of Dynamic Athlete, sports medicine physician, regenerative orthopedics innovator, and trusted guide for everyone from elite athletes to everyday humans who want to move pain-free and perform at a higher level. He's known for combining cutting-edge orthobiologics, shockwave, regenerative medicine, and systems thinking to help people heal at the root rather than just chase symptoms. He serves as the team physician for elite athletes, includes work with USA Hockey, and has deep expertise in concussion care and performance medicine. And he's helping shape what medicine can become when restoration replaces reaction. Well, appreciate having you on today.
It's always great. Thanks, Kyle.
So I'm curious, we have a pretty amazing shared colleague who went from the fitness route as a personal trainer into eventually medical school. So he had this unique lens, and a wife who was a naturopathic doctor of, moving from the natural health into the Western medicine. I'm curious, what made you start questioning conventional medicine early?
Well, it's really fascinating. I mean, I think my journey is a little bit unique in the sense that I got a chance to do my residency at Yale. I got a chance to do my fellowship at Andrews. Really proud of those 2 places. And then started my professional journey in Chicago, building a non-surgical department inside of an orthopedic surgery group. So it was the first non-surgical that they hired. They wanted me to build that section. The more that I was doing that and negating the need for surgery, you could see a little bit of the shift. And so when I got recruited in Nashville to do sort of the same thing inside of a bigger orthopedic surgery group, you could see that shift as well. And then you sort of take a step back and you say, most of these actually don't require surgery. And so if you look at this and you say, how do we take care of these people in their best interest? And you look at some of the things that you can do, you can negate the need for surgery. And I've had a chance to work with some of the best orthopedic surgeons in the country, and they will even tell you that most of these don't actually require surgery. So I think it's just the paradigm where it's backwards, like I mentioned before, about is that really the first place that you should go?
Right. Right. And what kind of injuries or experiences taught you the most about healing?
I'll give you an example like arthritis in the knee, where having a knee replacement doesn't always solve the issue. And especially if you're a younger person getting knee replacement and they last maybe 20, 25 years. So then are you going to get a knee replacement and then live 20, 25 years more, have that taken out and then put another one back in and just that whole process? Or are there things that can actually help like shockwave, like PRP, like stem cells, like all these things that we do that can negate the need or in certain situations push out the need for surgery. So this isn't anti-surgery at all. I don't want anybody to think that. It's doing things for the right reason, for the right purpose. So that's arthritis. The other one is a rotator cuff tear, right? Not all rotator cuff tears need surgery. I can't tell you how many people get surgery, but don't actually need it. So imagine you have a partial rotator cuff tear where you can actually fill in that tear with stem cells and repair that without having the need for surgery.
Oof. Well, you got into this regenerative medicine space way early when a lot of these types of tools and devices were considered quackery. And I can totally relate. I've walked down steps of things that people thought were horrific, and then now they're asking me questions about them. And, I feel like I woke up in a bizarre world. What pulled you specifically into this regenerative medicine before it became trendy?
I mean, I think a lot of it was, what am I missing? So I would be doing this and I said, there's a subset here that's not responding. Or I was giving steroid injections and realizing, hey, maybe this isn't actually the right way to go. And then you start to say, how can I make a bigger difference? And then you start to look and you go, okay, this is going to help. This makes sense. How do we use what's in your body, hyper concentrate it, and get it to where you're hurting? And I think that's really been the biggest thing for me is making sure we're doing things for the right reason. And then going after really, really hunting for what's the diagnosis. I mean, I don't care what you're doing, even if it's surgery. If your diagnosis is wrong, the surgery is not going to help. If the diagnosis is wrong, whatever we're doing isn't going to help. So really making that the epicenter of the treatment, that patient-centric treatment, is what is actually wrong with them. And then you can get to work.
So you mean in situations like getting to the, not only just the root cause, but the root cause in terms of where is the root dysfunction in the body?
Yeah.
So for example, in my case, we looked at, okay, how much of this could be stemming, this ankle stuff could be stemming from your low back. And I hadn't even told you about my low back injury, back in 97, but we were able to link it up through the kinetic chain.
It's pretty fascinating. I mean, I think if you have the time to do that, that's the other thing about the paradigm here. It's not designed for you to take time with people. So when you're in an office, you feel like a number. And if somebody's pumping 50 patients a day, it's really challenging to step back and take a look and be like, what are we actually going after?
Right.
So I think that's one. So we take a ton of time with our people. And then it's also the fun of it. For me, like I took forensic chemistry in college. It was one of my favorite classes because I look at this as almost forensic sports medicine or forensic orthopedics,
right,
where we're reverse engineering why you have this issue and then how do we solve that rather than just putting a Band-Aid on it or masking symptoms. We're trying to solve the problem so you can go do what you want to do. I don't want you in my clinic all the time, right? I want you out doing what you want to do. So for those that are in, 3 times a week for the rest of their life, I don't subscribe to that because that's not living to me. That's just managing your decay.
Well, you and I share sports fanaticism, right? So now, would you say you became a physician to help treat injury, or were you more fascinated by understanding human potential?
Well, it's a great question, Kyle. Growing up, I played baseball. I played in college. I played a year after and coached. And so hockey was actually my favorite sport, but baseball was something that got me into school and I was decent at. And then you start to look and you say, well, from a professional standpoint, I'm not going to make an impact. Well, how do I do this otherwise? And so that's when I started to look at, for me, there's not a lot that's really fun in medicine except for what I get to do.
Yeah.
And that's coming from my father's a cardiologist, my sister's a cardiologist. I mean, so, I could have had a handmade on a silver platter practice if I went into cardiology. And my buddies are like, you're a dummy. You should just do that. And I said, yeah, but I wouldn't be happy, right? Like, this is not for me. And so you start to look at that and say, how can I make an impact? And then with that background, and then being able to look at people as athletes, doesn't matter what your background is. I mean, our very first procedure that we ever did here in Boulder was for a woman who was trying to get back for gardening season.
Oh,
I said, do you want to wait until whatever time frame? She said, nope, gardening season's coming up. I want to be ready so I can go enjoy my garden. That's her sport. That's her season.
I love it. And the amount of rotational work is got to be similar to baseball, but at a different speed.
Yeah. So to me, it's about, I always hate answering yes to both of the options, but in this situation, it's, I want to optimize her.
Right.
Is she a team athlete or an individual athlete in the purest form? No, but that's her season. And that's how we look at it. And I think it's when you take care of athletes, there are some people that say they take care of athletes, and then there are people that take care of athletes. Right. And I think in our clinic, when we look at this, everybody's an athlete. It's just depending on what is important to them. And for her, it was gardening.
I love it. That was totally aligned with the way I approached fitness. Everyone would, I had the pleasure of working with Olympians and celebrities and pro athletes and stuff. And I would see that the athlete mindset was necessary for everyone going through transformation. If people were just focused on like, I want to drop 20 pounds, I'd be like, okay, well, we can start with your head. That's 8. What else? What else do you want to lose? You want to use your right arm, your left arm? And instead, if they could approach things as what would a world-class athlete do? And you are one, and how do you apply it? There's a sustainability factor there. Right. Have you seen a sustainability, marker within everything that you've been doing?
I think if you're doing things for the right reason, the sustainability comes. Yep. And part of this is having the motivated patient athlete. We call everybody athletes in our clinic. Are they motivated for change? I think the big thing is there buy-in? I think all of us strive to be part of something that's bigger than ourselves. Right. So when people are in our office, or when we look at this as a team approach. And patients come in our office and they're taken care of by our entire team. Front desk, practice manager, clinical coordinator, our clinical assistants, our PA, our interns, our students. When we're doing procedures, and I joke about this, our patients look around, they go, oh my gosh, there's so many people in here. I said, yep, we run like a NASCAR team. Everybody's got their role, and we want you to feel taken care of in a way that you've never felt before. And I think that's part of that buy-in. Like, you get buy-in from our group and you get buy-in from yourself. We're going to do really great things.
I love it. And, you utilize the moniker, the Regen Doc. And I know a lot of people are coming to you and they're trying to avoid surgery. What do you think that people are misunderstanding when it comes to pain and the pain paradigm right now?
I think pain is a signal, and it's almost like a smoke detector, right? There's a fire raging somewhere. The pain is the smoke detector. So when you use a steroid injection, which nobody should be getting a steroid injection, all that's doing is silencing that fire alarm. The fire's still raging. And so the pain, I often joke about this in the clinic where I go, I don't really care about your pain. I mean, I do, but I don't. I want to get at what's causing the pain so you can be out of pain, not just take care of your pain and keep having to address the pain. And that's where the mindset shifts and they go, oh, that makes sense. Now let's go after the cause of what's going on.
And then is inflammation the enemy, or is it again more of a response mechanism to what's going on, so you know where you need to look under the hood?
Oh, I love that question. I'm actually a fan of inflammation. The good kind.
Yes.
So
not the arguments at home that create inflammation.
Right. So imagine this. When you rest, ice, compress, and elevate, the old Rice method, which is out, this is where you're allowing stagnant inflammation to remain. What does ice do? It's an anti-inflammatory. So it slows down some of that rush that gets in there. And I understand in the acute setting, that's what people gravitate towards. I actually want to bring in good inflammation. So things like shockwave, focused shockwave, that's bringing in good inflammation, increasing blood flow. What's PRP? It's essentially hyperconcentrating the response, the healing response. Stem cells, you look at some of that. All of these things are designed to override the system from a good inflammation standpoint, healing standpoint. So I think inflammation's gotten a bad rap. And this is why when you're taking Advil, Aleve, or things like that, that's actually hindering your progress.
I want to stay here for a minute, because having experienced some of the technology, I think you have technology on a world-class level because you've dealt with world-class people, like, people who are winning gold medals for us right now. Let's chat a little bit about some of the tech that you have in this spaceship of yours. Yeah,
it's wild. I mean, if you told me that we were going to have the things that we have in our office before we started our clinic, I would say that's insane.
Right.
The combination of things that we have in our office does not exist in the country. I mean, that's a pretty big statement to say, right? Not pro team, not any other clinic. And so we try to take care of the athlete from head to toe. So our workhorse is our EMTT, which is extracorporeal magnetotransduction therapy. I know it's a mouthful. It's a big magnet that helps create a better environment for your cells to heal. Then you use focused shockwave, which is focused sound waves. And there's a lot of noise out there about this different shockwave, that different shockwave. I'll tell you, focused shockwave is what you want. So when somebody offers you unfocused shockwave or radial shockwave, which actually doesn't even exist, it's radial pressure waves, just know what you're getting into, because I think a lot of the time this term shockwave now has become this a big umbrella term. So we use focused shockwave to target the damaged tissue. And the beauty of this is that if you don't have damaged tissue, you don't feel anything. And then all of a sudden, if we're on it, you go, oh, that's exactly where I feel it. And so what we're trying to do is recreate that healing response. And then that radial pressure wave works on a larger area. It's more superficial, but that's what we use primarily for a musculoskeletal standpoint. The other components we use in a pelvic floor, where we use a chair that actually uses high intensity frequency, and it's electromagnetic, that you sit on and stimulate the pelvic floor. We use this for both pelvic floor issues, but also sports performance. So imagine this, you're training and you're a professional cyclist. And we put somebody through this who's a pro cyclist here in Boulder. And she said, I've never felt so strong through my pedals. Everybody's doing the same workout. So how do you get that edge? 1, 2, 3, 4, 5% difference. That's the difference between you making money and being on the podium and you finishing 10th.
I love that. And I think a lot of people, when it comes to fitness, don't realize it all starts at the core, at the center, and then moves out to the extremities. Instead, they're just monitoring, engaging extremities by themselves. Saying, how big are your legs? How big are your arms? How big is this? Oh, chest, back, like it's some isolated Mr. Potato Head BS.
Yep.
And the reality is it starts at the core. And I think, Joseph Pilates was one of the first to really push and promote that from the standpoint. Not that I'm saying Pilates is the end all be all. I think it is a nice add-on adjacent to resistance training. It's definitely not the foundation. Swimming is a nice add-on adjacent for lengthening the muscles, but at its core is resistance, but at its core is the core.
You could solve a lot of the world's problems if people's cores were better.
I think that goes for physiologically. And I think that if their core psychologically, emotionally, and how at their core they treated humanity, we would solve a lot of the world's problems.
There you go. And then that leads us to our last piece of tech that we have, which is a device that works on your stress and anxiety center.
Let's chat about that thing, because that is some mega mind crazy stuff when I saw it here. Tell me a little bit about it.
So think about this, where every day we're dealing with stress and anxiety and how to deal with that and how does it affect our function, and we're doom scrolling on the phone and we're on the computer and we're really not engaging in those strong neural connections.
Mm-hmm.
And so our device, so we have the ExoMind, which is in our office, where we target with really technology that's been around for a long time.
Right.
It's just a more efficient delivery mechanism. And now you're targeting an area where you start to realize that the things that matter you can focus on, and the things that don't matter sort of melt away. Mm-hmm. And I went to a conference and I was watching this, learning about this, and I said, I don't see how we don't bring this into our office. Not that I want to spend the capital and build this, but this just ended up happening. This was with the pelvic floor machine as well. And I had them do it on me. They were hemming and hawing. They said, I don't want to do it. I said, I'm not getting it unless I get to experience this.
Right.
So I was on the phone texting with my wife, Nicole, all day. And after the session, I called her and I said, I did it. And she said, how do you feel? And I said, I feel more calm. I feel more focused, and I feel clearer. Things that almost felt like I was putting the answers to puzzles that were blocking me, and allowed me to do that. And she said, I can tell because you sound that way on the phone. So I'm feeling
feel
it.
Into the energetics.
And she can feel it through the phone, just through my voice. And I said, okay, we're going to bring this in. And so that same athlete who was on the pelvic floor machine, we put her through the ExoMind and our Dynamic Mind Plus protocol. And she said, everything that allowed me that got in my way of training sort of went by the wayside, and I could focus on my training. We had a pro hockey player who set personal records in his strength training to the point where his coaches were like, what are you taking? Are you legitimately taking steroids, or did you do something different? And he said, no, I've been working with them.
Dang. It's amazing from the longevity standpoint. You've got people like LeBron spending millions each year on a longevity protocol, and you get to watch it on the public scale, right in front of your eyes. And it's a really beautiful thing.
It's wild. If you look at this, it's essentially musculoskeletal longevity.
Yeah.
Right. Or biohacking, or whatever term you want to use, but you're now transforming somebody. And even on our website, we talk about regenerative medicine for the mind and body. Like, we look at this from head to toe, and that's where you get the complete athlete recovery.
What's really fascinating to me is it is a form of energy medicine. And so much of the Western world has been completely closed off from the scientific religion. It's what I call it. It's not the scientific method, which involves curiosity, which is what's led you down this path, is curiosity and a realization that everything evolves. But from the scientific religion, they think in most cases, energy medicine is crap. And I say in response, my usual response is, that's fantastic. Hand me your cell phone. I'll see you later, because you've got a quartz crystal in that thing. That's the only way it's operating. So to tell me energy medicine is crap means you have no idea what you're talking about. And so from that standpoint, how would you describe, I know MRI is probably the closest thing that, the magnetic resonance imaging that people are in the mainstream familiar with, is like, yes, we're using magnets here to create an image. And that's pretty darn cool. How would you describe how a magnet can be used in healing?
I mean, this is your space too, the energy space. And I think we're embarking on how energy is used in medicine, where you can combine it with some of the other things that you're doing. I really believe that our success rate is so high, like over 90, like our hit rate is over 90%, which is a monster number to put up. And I think a lot of it has to do with doing things for the right reason, but also our combination of what we end up doing. And how I explain this energy medicine to people is, think about this in your cell wall, where on one side they're pluses, on the other side they're minuses. When that's there, it's a really good healing environment. Nutrients can go in. toxins can go out, really good influx and efflux out, right? Science words. And then you look at when they're injured or arthritic or whatever has happened, those ion channels now, instead of 3 pluses on the top, they become plus, minus, plus. They get distorted. So less efficient nutrients in, less efficient toxins out. So now you're in this chronic state. So what does a magnet do? It helps repolarize and recalibrate those cells. And if you look at that, and what's nerve pain? What's nerve? It's electricity. So you can use this to work on nerve pain. And then now you've created that really good healing environment. So then when we use the focus shockwave to target these cells, now they're more receptive to that energy. So now we can actually heal those cells at a better rate than if we didn't use the magnet prior and in conjunction with it.
I love it. I think that's one thing that throws people for a loop, is realizing that we are electric.
Yeah.
And I'm curious your take on the future of these orthobiologics, of PRP, peptide, shockwave, regenerative therapies. A lot of these things are changing, shifting at a pretty rapid rate. What are you seeing down the pipeline? What are you excited about?
I think the more that people can be informed that not all PRP, not all stem cells are the same, not all shockwave is the same, right? I detailed that earlier. If you can make that jump from, okay, well, I just got PRP done and it didn't work for me.
Right.
It's the making the PRP a commodity. Like, I'm going to go to the grocery store and I'm going to go get a loaf of bread, some eggs, some PRP, orange juice, and milk. Yeah. And then you just price shop without actually looking at what's in the ingredients. Oh. And so when we get people all the time that come into our office and say, I've had PRP done, it doesn't work for me. I've had stem cells, it doesn't work for me. And then I say, okay, well, who did it? How do they do it? What's their pre-procedure protocol? What do they do during? What's their X multiple they're trying to get to? How many billions of platelets are they trying to obtain? What did they do after? They look at me, Kyle, like I'm speaking a foreign language.
Right.
Right? They're like, what do you mean? I thought PRP is all the same. Like, I got PRP. What the guy said that he does PRP and he charges $500. So I went to him because it's $500. And so then you start to look and break that down. And I think that's where you're starting to see the elevation of who gets success and who doesn't. Partly also is doing things for the right reason. There's a guy who walked in my office and said, here's $5,000. Can you fix me? And I said, please don't let anybody take your money. I'm telling you, at the financial detriment of this clinic, to not do any of these because you need to go get surgery here. And here's why. And then we can help you before, we can help you after, but to solve your main problem here, this isn't going to work. And please don't let anybody tell you otherwise. And it's one thing to answer somebody, and then it's another thing to answer them and tell them why. It's the depth. Right? And that's where I think you ask about the peptides. You know, we were talking about this earlier. Peptides are getting a huge run right now.
Right.
There's less than 30 people that have actually been studied taking peptides for musculoskeletal cases. All of this has been extrapolated from animal models. And I think there's a little bit of danger in that, in terms of trying to rush into something that's there. The difference is, and people make the argument and say, well, PRP had the same thing, stem cells had the same thing. The difference is those were coming from you.
Right.
Those were autologous coming from you versus synthetic or coming from elsewhere.
Right. So let's go down a little bit down the stem cell rabbit hole, because there are a lot of different routes with stem cells. There's the heavily religious that looks at stem cells as coming from, unborn infants. And they have a take there. Then you have people who are looking at stem cells and saying it's completely changed and transformed my life. And when you say, what's the source? They would say their doctor's name.
Right.
That's the source. And then there's all the in between, down to people who truly understand stem cells at a high level and how they actually get into your system and what you do with it, or even if they come from your system. How would you explain the stem cell journey, to someone who's infant level knowledge of it?
Let's think about stem cells as signaling cells, not necessarily transformative into something else. Think about this in a way that if we put the stem cells where you're hurting, it's going to send a signal to surrounding cells to come help heal. And the more powerful that signal is, the more those cells are going to come and migrate to that area.
Mm-hmm.
So I think it changes the way that people look at stem cells as nothing more than a signal in that space that helps recruit its buddies to help heal. And so when you're taking either from the bone marrow or adipose, like literally liposuction, we're sucking fat out of people and minimally processing it and really just spinning and separating it and then injecting that back in. It's liposuction. And we're using that because that's where the cells are stored. These stem cells are stored, right? They're produced in the bone marrow. They're stored in the fat. And depending on what you have and why you're going to use one versus the other. But that's the beauty of this, is that we're taking something from you and hyper concentrating it and then putting it where you need it as almost like a system override.
Oof. And what about with the peptide game? I've heard peptides described as signals as well.
I think there's going to be a role for peptides, and I think the media and the exposure and just everybody talking about it has almost put the cart before the horse here. Right. And I think there needs to be a little bit of a slowdown in terms of people asking about it, because they're looking at this almost like as a quick fix that's been promised to them. And they just keep feeding on that space versus actually fixing the problem. And I think that's where a little bit of the challenge is, because we get asked about peptides all the time. I mean, I get a text message from a high level runner who's asking about peptides. And I go, I get this question all the time. And I said, I think this is sort of where you're at. The challenge also becomes where you're getting them from.
Right.
Because it's not coming from your body. So then where you're getting it from, and how safe is that? And is it clean or dirty? Who knows? And so it's coming. Mm-hmm. And I think people are just less patient about it right now. So officially on the record, like you can't, in my mind, for us, I cannot recommend it in good conscience, because there's not enough there for me.
Yeah. The data, it's do you want to be a human guinea pig or not?
Yeah. I'm not saying that everything needs a randomized control trial.
Right.
I'm not in that camp. I'm talking about real world evidence and being able to follow and be able to do some of these things. I'm a big proponent of real world evidence. That's what's lacking here.
I'm going to add to the real world evidence, because this has been big for me, being in the supplement manufacturing space and the fitness nutrition space for so long, is real world evidence sustained over time.
Correct.
And I think that piece people forget, because they go, well, Jenny lost 45 pounds on Ozempic, and so it's great. I'm like, ask more questions.
That's right.
Have Jenny come see me in 5 years. Where's Jenny at in 5 years? Oh, well, her weight loss may have been partial muscle loss. And could it be more than just skeletal muscle? Could it be the muscles around, microorgans? And, I just don't know if that's the place I want to be a human guinea pig.
You make such a great point. It is the over the time piece.
Yeah.
Like, that is so imperative. That are you willing to risk something that you have no idea about? I'll give you an example. There was a high level runner came and saw us, and we were talking about things that we were doing. And I said, I don't think your problem is here. I think, much like we talked about, I think your problem is elsewhere. And she said, well, what's the evidence of that? Who else is doing this? How do I compare it? And I go, well, this is missed a lot. This is why we see this a ton in our office. And we're in the process of, collecting and all of our data. And then she said, well, what if I just go get IV stem cells? And I said, okay, well, tell me what's the evidence on that, right? So on one hand, you want the evidence there.
Right.
But then on the other hand, you're fine getting peptides or exosomes or IV stem cells. I'm like, it can't be both.
Right.
Right. And I think that's the challenge. And that's where people are getting confused.
So where I first learned about the sustainability over time factor is actually from my first degree, way before the fitness nutrition space, which was journalism. And in English, we all learn this in high school, which is what makes a book a classic.
Yeah.
And you don't just automatically become a classic. And when somebody says an instant classic, that makes no sense. A classic has to be proven that it can, sustain over time and different generations and different variability. Yeah. And that's exactly what we have to do. We have to sustain over time, different generations, different environments. This is the 2020s versus the 1980s are night versus day, right? And so when you're looking at this, what's really fascinating you right now in that regenerative medicine space?
I think we're always trying to get better.
Yeah.
And we look at how do we make our process better here? Or what do we do here? I mean, there's certain things that we do to enhance our biologics that other people aren't doing, where it's not as painful, or we're trying to look at some of these things. So how do you incorporate this energy medicine? I mean, we started a training institute here in Boulder. People were like, we want to come learn how you're doing this and why are you getting these results when I'm using the same protocol, quote unquote, the same numbers, but I'm not getting that result that you're getting. So it's about technique. It's about knowing what you're doing. So having again, I go back to time, which is your most valuable asset. And if we're able to buy back time, isn't it worth what you're going to spend? And there's a cost to everything. So you may not spend money to get treatment, but you're going to spend lost time not being able to play with your kids.
Right. Right.
So there's a cost either way.
And I think all comes down to that quality of life factor. It's like, congratulations, you saved all your money and you went through the life journey and now you've got money to do what with?
Right.
Can't take it with you to the next step.
No. And I think that's where it's hard. And this system is broken.
Yeah.
When people look, well, I'm just going to get whatever's covered by insurance. And then you look at, well, insurance actually isn't in your best interest.
Right.
They're managing your decay, not keeping you active. There's a big difference here, right? And so I think that what's really exciting about our side is when you see people that come in our office and they've had months or years of pain. I'll give you another quick example. There was a woman who we saw post radiation treatment for breast cancer. She had fibrosis, so thickening, where she had trouble lifting her arm up. And we did a little bit of work with her with EMTT and shockwave and the radial pressure waves. And really, we also did stem cells with her. And she could lift her arm over her head. I said, when's the last time your elbow was at the level of your ear? She said 7 years ago. I mean, what do you do with that? Our group sees this all the time.
Right.
And it never gets old because you just look and you're like, that's awesome.
It's a new trajectory.
She gets to use her left arm. I mean, right? She can go lift and go grab a coffee cup. That's one of the examples she used. She's like, I have to think about which arm I have to use to go grab a coffee cup.
I want to take it to the other end of the spectrum, which is the elite athlete, because I think there's so much we can learn from them because they are the closest thing to in a vacuum that we can get, right? Like compared to the rest of us that have less predictability, discipline, repeatability. And what do you think that these elite athletes understand about recovery that ordinary people just completely miss?
I think a lot of it is the importance of the actual recovery, where a lot of people talk about high altitude training, but not a lot of people talk about high altitude recovery.
Expand on that one.
Well, we live in Boulder here where the oxygen content is less. And then how do you recover after your run? So sun exposure, talking about dehydration, it's a huge problem here, right? When I was drawing blood in Chicago and Nashville, which are closer to sea level, not as challenging. I get here and we have to really tell people to hydrate beforehand so we can get the amount of blood that we need. So there's a lot of stuff that if you look at where even the energy medicine is huge for recovery. I mean, even in your world where you deal with energies all the time, you can see and you understand this, why energy medicine can make a big difference in recovery.
Right.
Right. That electromagnetic component that I talked about, that if we're getting cells to be in a better environment, they're going to heal better. They're going to recover better. And so you start to couple those things. And that's what's exciting about recovery component, is the difference between the elite athletes and others is they invest in their recovery.
So you and I both work with a similar type of clientele in the sense that a lot of these driven individuals, high performers, if you will, what patterns do you see that these overachievers carry in their bodies?
A lot of it is stress and anxiety and almost this overactive nervous system, where this is where we talk about using the exomind with the dynamic mind plus. Like, you look at this and how do we reset the nervous system? So now imagine you're trying to recover, but your nervous system is on such high alert. Do you think your body's in a good state to recover, that rest and digest almost, versus being on high alert all the time?
Right.
And so if your body's on high alert all the time, is it recovering or is it just protecting you?
Yeah. The blood flow is going to go to the extremities for fight, flight, freeze, and it's not going to stop and cook a filet mignon.
So when you work on grounding yourself and centering yourself and using some of these things to help you manage your stress and anxiety and reset the nervous system, do you think your stem cell procedure is going to have a better outcome if your nervous system is reset? Unquestionable, right? And I think that's what a lot of people are missing, is like, we're just going to, I use this example a lot of when you're gardening,
right?
Do you just throw seeds on the ground and just be like, all right, I'm just going to wait for these to grow? Or do you work at the soil? Do you cultivate a really good environment around it? And then you get maximum growth. That's what we're doing here.
So bringing this to the everyday athlete, do you think someone can get more athletic in their 50s than they were in their 30s?
Without a doubt. I think if you start to prioritize things in a way and you start to look at these things that can, in combination, affect what you're doing, you're going to be way better off. Now, from a genetic standpoint, and that, I get it. You're going to, it's like, when you get hungover, you don't really feel it when you're younger,
right?
But boy, you feel it when you're older, right? And it's sort of those other things. You have to take care of yourself in a different way. And I think actually in a more complete way. Right. And then you get these younger athletes that are now essentially buying time. What they're doing, if they start early, right? If you have early arthritis and you don't say, well, I'll just deal with it. And you say, nope, I'm going to go get this taken care of. I'm going to go get shockwave and stem cells, and I'm going to do whatever I can to preserve my knee. It's essentially joint preservation.
Nice.
And buying back time, right? These people that have a year of pain, what if we got them back in 6 to 12 weeks? Right. Even at the 12-week mark, the 3-month mark, we've now bought back 9 months of significantly less pain.
And it sounds also like a lot of that peak performance is coming back to do with being regulated versus I'm going to do this through incredible intensity. Right.
And I think it's that when you asked about higher level athletes, it's that balance point of, okay, I'm going to take care of myself pre, I'm going to push hard during, and I'm going to recover afterward. And so I tell athletes all the time that, pro athletes take time off during their season. Like, their season doesn't run 12 months. They still take some time to recover.
Right.
And then when some of these athletes, you look at them and they go, what do you mean? I got to be running all the time. And so what I ask them is, what am I trying to get you ready for? well, I have this marathon in March and it's October. And I said, okay, well, this is the time, and we sort of work backwards. And I kind of tell them, I said, I don't care about your October run. You told me you have to get ready for March. I'm trying to get you ready for March. So we have to augment your training so you can let your problem recover, so you can get ready for March. Who cares if you can run in October? It's just from a mental standpoint. So when you shift that, then they're like bought in. They say, okay, let's go.
One of the most beautiful things about team sports is that if you're the spectator and your vested interest is just fandom, you can watch all of this happen with how they handle things like load management, in season, off season.
Yeah.
Right. Our Nuggets are sitting a great player tonight because he's not fully ready to be in. So they're letting him have that recovery phase so that hopefully we can get him towards the playoffs. And it's a cool thing to watch. But then we forget about them ourselves. We're like, well, I need to train 7 days a week, no days off.
Well, I mean, I would make the argument and say, could that player benefit from energy medicine, especially in season? So our protocols are very different in season versus out of season. And so that gets back to what was done prior to the injury, what was done during the injury, what are we doing after the injury? So those are the things I would sort of look at. But yeah, I mean, I think there are options where if people don't know about it, then how do you use it? I mean, there's teams that have energy medicine that's sitting in their training room and they don't use it because they don't know how to use it.
So if you're pulling your magic ball out, since, we've already gone into the maximal boost space and you're looking 20 years into the future, what do you think that's commonplace now is going to look primitive then?
I think you won't see a steroid injection because there's so many better things out there. I think you will see an orthopedic surgeon when there's a surgical indication for things. And I think my hope is that you're going to see people be even more active because you're starting to curb the issues regarding musculoskeletal medicine, and your three options in this broken paradigm is physical therapy, steroid injection, surgery. We've just now opened up a whole different place where we live in that gap between when you get hurt and when you have surgery. And I think that's the beauty of this, is that you're starting to see people understand why this is important and why the old way, the old archaic way of, it's not even treating, you're masking symptoms with a steroid shot for the most part. And people say, well, what happens about an inflamed bursa? And I said, you don't wake up with an inflamed bursa. It's usually a tendon that's been thickened that's rubbing on that bursa, causing that, right? And so it goes back to what's the reason? Yeah, and that's it.
So we've had the benefit of doing some pretty epic work together even recently. And I know you've been on a very path of embodying the best and highest version of yourself. And I'm curious if through a reflective lens, what has injury taught you about spirituality?
I think they're divinely connected, and I wasn't a very spiritual person growing up, despite my parents being very religious and supportive in the same breath. I think it teaches you that no matter what, it'll be okay. Like your path forward will be okay. I tell people this a lot, where somebody comes in with an ACL tear, and I said, it's okay. Whatever it is, we'll take care of, and you'll get in. And you'll progress forward. And I think part of that is having that to hold on to. And that's where, and I think that comes from within, really, not somewhere else. It doesn't matter really what I say or anybody else says. Do you believe that internally and say, okay, this is the hand that's been dealt to me. How do I deal with this? And then how do we get better?
Right.
And that comes from within.
And it's the creating of that safe space to heal, which from a left brain scientific standpoint will regulate the nervous system once it feels safe and allow itself to rest and digest. And then on this other side, there's the envisioning part, where if you can't see this healed future, you're setting yourself up to keep repeating the past.
I mean, yeah, that's a great point. Like in our office, Nicole's an interior designer by trade. We tried to make a place that feels warm, safe, welcoming, and a good place to heal. Like you walk into our office and you don't think that this is a high-end regenerative medicine clinic. You're looking around, you're like, this feels good here.
Yeah.
Right? Like we're listening to music, there's plants, like all these things that we're trying to create this environment where you feel safe, and then we can figure out what's going on and then how do we fix it, right? And if you're with us for a couple of weeks, and then we've had people that'll say, I miss being here because I feel safe here. And then you get to the other side, like exactly what you said about the left brain. Then we get into, all right, here's the analytical approach to how we're going to tackle this. And now you meld both of those together.
That's right.
And that's, I think, you get optimal recovery.
I'm going to throw a third piece in there that is unique to your office for this type of work is inspired. And that also, when you've worked with the athletes that have won gold medals and, worked with things like Team USA Hockey, you've seen people do the impossible.
It's really cool. I mean, I think, I told this story where my very first USA Hockey trip was with the 2001 birth year. So if those of you that follow hockey, that's Jack Hughes was on that team and drafted first overall, and Matt Boldy was drafted by the Minnesota Wild. And so those are guys that we had a chance, and we won that tournament. And so I have that tournament's gold medal at my home. And now these guys are the gold medal games goal scorers, and they have won a real gold medal. And, I got a chance to catch up with Boldy after he came to Colorado and just talk to him about it. I mean, it's just really cool to see these guys, and you talk about inspired. It's really cool to see them go after things at such a high level. And when you take care of people in that same mold, be it an Olympic gold medalist or a gardener and everywhere in between, or I think that's what's the drive. And you say inspired, that's what drives our group, is how do we get them out of our clinic in a better way than when they walked in here?
And a sustainability over time. I think the athletes, the other thing they have that's really unique is the long-term vision. They aren't like, well, I'm going to pick up this sport, and in the first year, I'm going to be in the NFL the first year I play football, and I'm going to win the Super Bowl and be the MVP in year one of playing football. Right. Yeah. But when people are looking at a problem, they're like, well, I got 30 minutes to solve this problem that took me 35 years to develop. Right.
Well, it's like the straw that breaks the camel's back. Was it that one straw? No. It's been building for years and years. And is it a functional issue? Is it something? I mean, so there's a whole host of things. And I think it goes back to, if you're rewarded financially for seeing as many patients as you can through the system that is in place, or do you break away from that system and say, I want to take care of the person who's in front of me, and I want to figure out how to take care of them in totality for a longer period of time, rather than just pop in a quick shot and be like, great, and then they'll come back and see you in 6 weeks.
I always say customer service is the easiest thing ever. Treat everyone like your grandma.
Yeah, I tell people all the time this. I go, if you were in my family, this is what I would tell you to do. And just, you look them right in the eye. And I tell them, I go, I don't know any other way. That's what I learned in residency. That's especially what I learned in fellowship. I can't tell you that our orientation and fellowship, and it's one of the best places you can go for what we do. And I say this because I'm proud of it, not from an arrogant standpoint. But our CEO for that fellowship, Lisa Warren, told us, we're going to teach you how to create the Disney experience first, and then be good doctors second.
I love it.
And that stuck with me. And I said, my gosh, like, yeah, you're right. Because it's not devaluing our skill set, but you have to create that environment that's going to allow your patients to succeed. I don't care how smart you are. I don't care how good you are. If that isn't there and you don't get buy-in, it's like any team. If you don't get buy-in from your patient, you could be technically perfect and there's going to be less success than if you have complete buy-in from that patient or that athlete, and they're looking at you and they're hungry to get back and motivated and inspired, like you said.
I love it. And if you're listening at home and you're a business owner and you're way too focused just on conversion rates, like you're trying to change their religion, sustainability comes when people feel safe and they actually see the results because you're being treated like family. And then you worry way less about what's my churn rate versus like, how long are people actually sticking around? You're like, well, just churn and burn it. And again, now guess what? You're an entrepreneur who became a factory worker in your own factory.
Yeah. I mean, I think at the end of the day, it's what are you doing it for? Right? You hear this all the time. What's your why? And why are you doing this? If it's monetary, probably in the wrong business.
Just go start an OnlyFans. Don't waste your time trying to be an entrepreneur.
Right. I mean, this is hard. This is not for everybody. This was never my dream. I didn't wake up and be like, when I'm a doctor, I can't wait to have my own practice. Right. My dream was, how do I work in a big group where we get to collaborate and do this stuff? And that isn't where medicine is right now.
Nope.
And so, especially in the sports and orthopedic standpoint. And so I said, okay, well then I feel like I'm getting held back and I'm not using my skill set to its optimal potential. And let's go do this. It's been super hard. We came out here and didn't know a single person and built all of this through community support, but it's been worth it because you see the impact that you can make in a community, and it's been tremendous.
I love it. I'm going to hit you with some quick ones. So just first
let's
thing that flows in. So one recovery tool almost everyone underestimates.
Sauna. Infrared sauna. And you can take it from the Finnish folks where we had a tournament in Finland for USA Hockey. There is a sauna on a Ferris wheel in Helsinki that you can rent. That's how serious they take their saunas there. So
epic.
Infrared sauna. That would be the best one.
Love it. Most overhyped trend in health right now.
Oh, I mean, can I say peptides? But I think I just say that in jest because of what's going on. But I think I'll go with that one. Yeah, let's go peptide. No, let me go back. Let's see. You asked me for a quick hitter. Overhyped. Oh man, I'm getting stumped here. I think I would go with maybe massage gun then.
Oh,
let's go massage gun.
Nice. PRP or shockwave? Pick one stranded on an island tool.
I think if you're on an island, probably a shockwave, but the right kind of shockwave. PRP can get very messy on an island, so let's go shockwave focused.
Easier to run on yourself. Too.
Right.
One myth about aging you'd love to kill.
That getting older is an acceptable answer as a diagnosis. I think that's lazy.
I love that. Favorite athletic mindset lesson for everyday life.
Go hunt for what you're after and be relentless in it, because then when you succeed, it's because you gave it your all. And if you don't succeed, you don't question effort.
I love that. Something you've changed your mind about in medicine?
Really? It's shoes. I think I was looking at shoes wrong my entire life. I used to wear a very well-known company that sponsors USA Hockey, and I used to wear those shoes all the time. Mm. I think thicker soled shoes are causing people more problems. Mm. They're babying feet and foot and ankle muscles where they think bigger is better there. I'm like Hoka's are an example, right? Where I've had people come to our office and we've had other shoes there that we try them into. I've had people just throw their Hoka's out in our office, and they said, I'll just take these demo shoes. I go, they're not really for sale. They said, I'll just give you whatever money it is to replace them because I want to take these home.
Oh, that's epic.
So, yeah.
Morning ritual you rarely skip.
Well, saying hi to my wife and petting my puppy. I mean, I think that those two things ground you. And I think that's really a big thing is you realize like, what's it all for?
I love it. I love it. A book every high performer should read.
Killer Athletes.
Haven't heard of it.
Yeah, it's a mix between military and athletic performance. And I think it's a mindset. I mean, really, if you can change the way that you attack problems, you're going to see such a difference in the way that your outcomes are.
One more for you.
Yeah.
If the human body had a user manual, what chapter do people ignore most?
The mental side.
Yeah.
Yeah. I think it's the mental and spiritual side of it, because it's hard and abstract and you can't see it in the mirror.
I love it. Well, I want to turn the tables with you.
Yeah.
And give you a chance to ask me a question you're genuinely curious about with self-trust or consciousness or performance or anything.
Well, I mean, I think, I'm always in awe of what you do. And so for me, when you take a look, and especially your background, when you take a look at that athlete, and we're talking about mindset, what would be your answer to that last question in terms of, from an operating standpoint, what's really missed by most people?
I think what most people miss is how much their heart set is needed in the mindset equation.
Explain that to me.
So if we just break the mind down as the physical brain and the two different hemispheres, most people look at their life as a giant problem and then a million problems that keep coming at it. And then they try to solve the problems from the same place that created the problems. And we understand that conceptually, metaphorically, but we don't understand, well, how do you solve the problems differently? And the way we try to solve the problems is, well, let's attack the problem. And in reality, what that does is that just puts lighter fluid on it. And so instead, a lot of times the first step is realizing you don't even have a problem. And if you can get into the heart space, what we've amplified as huge is typically microscopic, because in a more practical terms, our amygdala, which I have all my clients name their amygdala. So let's say Amy.
Okay.
Amy is the typical worried mother, and her job is like the water boy on the sports team to keep you safe. Now, working in USA Hockey, did you ever look, hey, coach, I need you to sit down for a minute. We need the water boy to come in here and coach the rest of us. He's also going to coach from the ice like LeBron coaches from the floor and is going to score the game winner. You'd say that's insane.
Right.
But that's what we do, is we give all of our power over to the worried mother instead of saying, hey, your place is very clear. It's very important, but you are not team captain.
It's almost like respecting their position, but not allowing it to drive the car, right? It's like, it was this example that somebody gave where they can be in the car, they just can't drive.
Right. And none of it's broken. It's not like killing it. Like everyone, the new trend now is let's kill your ego. And I'm like, you want to kill your ego? Just die, because that's when your ego is gone. It's like
or going to medicine, because I'll tell you, that'll drive your ego down.
Right. Right. But that's like a ego driven confidence versus this soul fueled confidence.
No, you're right. And I think it's the relationship, right? Would you agree with this, that it's the relationship to these things that needs to be worked on, not just shoving it aside?
All of it is relationship. And so much of the things that created these issues that need regeneration is because of exactly that. We shoved it to the side. Yeah.
No. And I think what's the biggest challenge for people, or that you experience with people that come from that scientific background, that look at this with hesitation and skepticism, that you face?
Timing. They need to be at a point where the first step is realizing they can't continue to do what they're doing and that it's worth making a transformation. They need to be in transition. From caterpillar to butterfly, they need to be in the chrysalis in order to create change. You can't get somebody and force them to convert if they're in denial. It's not just that river in Egypt. They're in a state of like, everything's going great. And you're just looking at them and you see like 15 red lights on right
Yeah.
now, and you're like, oh, it's all going great. Well,
Yep.
here's my card. Give me a call when you think in your own perception that you've hit rock bottom of sorts. And to me, rock bottom is a state of mind.
Mm-hmm.
And it's a personal decision. Like some people, rock bottom would be like in school, oh my God, I got a B-. And that could be the equivalent of somebody else of like, I just robbed a bank while on meth and then slit someone's throat on the way in the door.
Right.
So
Yeah.
it's right about what is the personal perspective.
Well, it gets into buy-in, right?
That's right.
Otherwise, you're not going to have a good outcome if they're not bought in.
One more for you.
Yeah.
I'm curious, what does harmony mean to you?
I think if you feel comfortable with yourself and comfortable in your own skin, and you are welcoming those around you in a way where you're a source of safety versus apprehension, then I think that's what harmony means to me and what I strive for and struggle with. But to me, it's really that piece of understanding and accepting others and yourself. And I think when you do that, then I think you're in harmony.
I love it. Well, this has been a joy and a blessing, and more of a conversation about where is the evolution going from injury than a focus just on the injury itself, which is true holism. So for those who want to come on into Dynamic Athlete, fly in town if they're listening from somewhere else, because we get people do that all the time. What's the best way to follow your journey, learn more about the insight, and go from there?
Well, there's two. First of all, thanks for having me. I feel like we could be doing this for 24 hours straight and just having chats. But the big thing is you can go to dynamicathlete.com. That's a first step. Go read about this stuff. And I think to get yourself educated and be informed. And then we talk about this stuff all the time on the Regen Doc podcast. So just tune in, pretty quick hitter episodes, but really it's just more like this, where trying to explain things that you think, oh, I didn't know that was actually out there. So those would be the two places I would tell you to continue on this path.
Amazing. Totally appreciate it. And we'll have you back on and more to come.
Always a blast. Thanks, Kyle.
Take care.
All right, my friend, if this episode sparked something in you, don't just wander off into the abyss of the internet. Hit subscribe so you can actually get the good stuff when it drops. And if you're feeling generous or mildly enlightened, leave some love in a review. It takes just 30 seconds, and somehow it feeds the algorithm gods so they know to send more people who really need it. Now, if you want to step deeper into my world, rapidharmony.com is where the real magic lives. Coaching, community, rituals, and a few surprises that are way better than just scrolling around another motivational reel and not doing anything about it. Thank you for listening. Thank you for being you. And remember, your inner harmony isn't hiding. It's just waiting for you to pay attention. I'll see you on the next episode. Now go subscribe before you forget.